here it is. It's been actually a couple days. I had to a few times redo and add more of the resin because it was still leaking from underneath. I finally must have found the leaks because it's holding water. It's not perfect at all. I put water in too early and the resin in the very bottom clouded, but my main goal was getting it to hold water so that it would be a little fountain out here. I could always put decorative stones in the bottom or something, but it just looks very cute from my window, just pumping water. So I'm happy with that. It's very imperfect because the wind blew a bunch of bark into it too, so hopefully that'll wash off a little bit. Anyway, so now we are going to go and try to perform a Ptest, which is literally a Ptest for Bree, who I believe is a little over a month and a half along. Anyway, she hasn't coming back into heat, and I think she looks like she's got a little baby bump, but I have my syringe to gather some urine, and then there's these little vials that come in here, and then I'll read the directions, how much to put in or whatever, and I'll show you. We'll look at that. I think it's been 4 days since I said I was going to do the Ptest on Bree here, the little buckskin doe right here, and I have yet to been able to collect the pee to do the test. So I'm out here again trying to wait her out to see if we can do the pee pregnancy test. Quit bopping the baby into me, you're hurting me. He is so fine and they are so rough because they think they're going to get a treat or he's going to get one they're not going to get or something. Burley, stop. Okay. Miss Betty, the queen, and she can be pretty rough with these other guys, I'll tell you. I was going to give my goats their copper today, and I went to get my copper out and realized I only had one 4-gram copper bolus tablet left, capsule. So I gave it to the larger one that seems to be suffering the most from the copper deficiency. They all seem to have fishtail, well, except for maybe BJ and the babies. Bree definitely needs some, but I'll have to order some. Betty doesn't seem to need it, but I'll give everybody one, and I will probably dose Samson again with another, because I think the last dose I had was 4 grams, and you're supposed to give a gram per 20 pounds, and he's got to be more than 80 pounds. He's pretty darn heavy, so I'll give him, and he's very deficient, so there's no worry of toxicity with him. You can see right here, Bristol has fishtail. She needs a good dose of copper bolus. So, here's little Miss Bliss and her mama sharing some minerals. I spread it around just like that on just where everybody can get to a pile. So you can see Briar over there has his own little pile, so they don't hurt each other over it. But also the geese eat it, so they get some minerals too. All right, so I'm going to work on waiting for Bree, and then when I do get a collection of urine from her that I can perform the Ptest, I'll come back and we'll do it together. There's little Cheyenne and Frank. Cheyenne laid an egg the other day. Today would be day 4. I don't see growth in the egg, but I'm not 100% confident, so I'm going to wait to see if that one egg, and it may not start because of the stress of moving, but I don't think she's done laying. She started laying later in the season than my other geese, and 2 of my other geese have started laying again, not regular, but once in a while, and those eggs are all starting. So that's obviously good for me. Better if they hatch. Sebastopols are very hard to hatch. And there's Miss Bree. Okay, I'm going to turn it off, and I'll be back if I collect. She's about a month and a half, a little over a month and a half along. You can see it. She's due August 30th. She definitely needs her copper. She's having her hay. They get Timothy pellets and sweet feed, but lately they've been just getting the medicated goat chow, just to give everybody a dose of, especially keep the babies on cocky preventative. Okay, bye for now. Finally. So let's see. Read the instructions and do the Ptest. Blue partridge Brahma chicks. They're so cute. They're sold and going to ship out, so I don't set them up in a brooder that, for growing out chicks. I set them up in a brooder to keep them warm and fed and watered, so they just have their little heating pad there. Not easy to find a heating pad that doesn't turn off anymore, but I have one. So I just keep them in this little box with food and water until shipping day. The results of Bree's Ptest were positive for early pregnancy. And I suspect I think she's about between 45 and 50 days pregnant, which is right where you want to do the Ptest. Well, I did 2 tests, and just as it was getting time to read the test, my cat walks by and knocks the little vials over into the floor. And one of the instructions on the little vials is not to disturb the test once it starts, because you don't want the chemicals just mixing up and mixing up. You want them to settle. So obviously those two tests I wasn't going to trust. So I ended up doing a third, and that one came out positive. It came out with the light green, which is early pregnancy, which I expect that she is, because I know when she was bred. I have her due date around August 30th. And she's just about, I would say she's just about 50 days pregnant or so today. So it came out proper. And then, of course, the ones that the cat knocked around came out as negative. So it shows that they're very sensitive, but I believe probably accurate. They do have, I believe it's a 94% accuracy probability, which I believe human pregnancy tests are the same, or they once were. Anyway, so some people have tried the strip dip tests and didn't find they were very accurate, but I think this one is, and I know when Bree was bred, and I know the last time she went into heat, and so I expected it to come out that she was pregnant. So anyway, it would be fun to do. The thing with the pregnancy tests is that they are so sensitive that if you don't use the right chemicals, if you used, say, the pee from a buck, you're going to get an altogether wrong reaction, because the test is looking for certain chemicals. If you test a doe that has a urinary tract infection, that doe, you're going to get a bogus test, or a false negative, or a false positive. So you do have to kind of know your animals, and sort of